talk of infertility, a lot of negative emotions and depressive thoughts accompany it. It is an emotional roller coaster for couples who wait anxiously every month, every cycle, to see those positive two lines of pregnancy test. In fact, it has always been a social stigma and a taboo in our Indian society. Many societies and people from different sects and belief link infertility to various superstitions and traditional beliefs, whether it is related to its cause or related to its remedies, which hold them back from coming forward and taking any kind of treatment. Since ages, it has been a reason for disgrace for females, cause of divorces, broken marriages, domestic violence, and polygamy. But now it's time for infertility problems to come out of the closet and break the silence. Every man or woman wants to become a father and a mother. This powerful desire for the parenthood has stimulated and sparked some revolutionary researches and discoveries in the management of infertility, which we will discuss today. Myself, Dr. Tanu Batra, Center Head Indra IVF Jaipur, will discuss about these new advancements in the treatment of infertility, which are the ray of hope for the disheartened childless couples. Newer techniques have developed, supported by the advancements in technology. We now have thorough knowledge of the disease, its diagnosis, and different kinds of management. Basic and advanced tests for evaluating both the partners have helped clinicians to move in the right direction. Now, there are various tests for females, such as hormonal assays, AMH for total egg reserve, HSG, transvaginal sonographies, which help us to do the follicular monitoring to detect any kind of adnexal pathologies, laparoscopy, hysteroscopies to know in and about the uterine and adnexal pathologies. For males, there is semen analysis test, sperm function test, hormonal assays, and ultrasound. There is one more important test which I would like to mention. It is the DNA fragmentation test, which finds out the functional integrity of the sperm DNA, through which chances of recurrent miscarriages and repeated IVF failures can be predicted and taken care of. Other tests such as the karyotype, Y microsome deletion test, gene experts have broadened the horizons to discover all sorts of etiologies responsible for infertility. Coming to the treatment part, the battle against infertility started many years ago, but 25th July 1978, it marks the date as a game changer. It heralds the beginning of a new era. It was in this year that the first test tube baby Louise Brown was born. Since her birth, IVF has transformed the field of infertility. Initially, the IVF success was less, but the treatment over the time, the advancements in the treatment, which has been expensive initially, but in due course of time, due to increased awareness, increased demand of treatment, and increased incidence of infertility, the evolution of ART techniques have occurred, that is the assisted reproductive techniques, accompanied with mushrooming of many IVF clinics worldwide. Also, these techniques are now affordable and they are associated with a good success rate. As we know that men do not face the same backlash from infertility as do females, but infertility affects both male and females equally. When we talk about advancements in male infertility, then definitely ICSI technique is a major breakthrough in the treatment of male infertility, in which firstly we prepare the eggs and then we inject each egg with one sperm, helping those cases which have the abnormal semen parameters. So those males with nil sperms can also make use of other techniques like micro TISA and TISA techniques, which help to identify those parts of the testicles from which sperms can be obtained and used with the help of the ICSI technique. Other than this, I would also mention about two more techniques which have increased the implantation rates. They are the blastocyst culture technique and the laser assisted hatching. Now, what happens in the blastocyst culture? This is the technique which helps to select the robust embryos, which are day 5 or 6 post fertilization embryos, formed in the IVF or ICSI techniques. As this blastocyst transfer gives a very good implantation rate, so a doctor can be confident in choosing and transferring a single blastocyst and avoiding the risk of multiple pregnancies. It is, in fact, a very good option for all those couples with secondary infertility who already have one child and they are planning to have a single child. Now comes the laser assisted hatching technique. What is it? So, this technique, first of all, it is useful in females with increased age, prior history of any tuberculosis or any repeated IVF failures, in case of FET cycles, that is frozen embryo transfer cycles, unexplained infertility. Now, in this, laser is used to thin out the outer shell of the embryos so that hatching becomes easy and implantation is increased. The past decade has also observed one more major breakthrough, which is the freezing technique. Latest one is called the vitrification technique, which avoids the formation of ice crystals which used to result from prior freezing techniques. And it used to cause damage to the cells. By the help of this freezing techniques, it has been possible to freeze eggs, sperms, and embryos. Embryo freezing is helpful in reducing the risks and the complication and also the low success rate which was associated initially with fresh embryo transfers. The technique of egg freezing has also harnessed the tickling biological clock of aging females who can preserve their eggs at a young age to be used at a later age to get healthy babies. In fact, this magical technique of vitrification, that is freezing, is fertility insurance in disguise. Now, the females who can't plan to have a baby at young age due to either career commitments or late marriages can be benefited by this technique. The advent of new injections such as the GnRH agonist triggers and recombinant injections have drastically increased the success rate and also reduced the complication rate such as the hyperstimulation to almost nil, which is a very good news for the infantile couples who want to go ahead for IVF process but are held back because of fear of painful or dreadful side effects. IVF has now become a very simple and a smooth process. And I'm sure you will not carry any flashback bad memories after you get the IVF done. Also, there is a good news for the cancer patients as these patients can preserve their gametes before they resort to chemo or radiotherapy. Now, there are many couples who have repeated abortions. So, having repeated abortions or congenital abnormal baby is a most traumatic experience for the parents. But now there is a ray of hope for these couples as they can go forward with PGS and PGD techniques and experience an uneventful pregnancy and have healthy babies. In present scenario, when the workload is more in IVF labs and the patients are worried about the authenticity of the labs and about the mixing of the gametes, then of course the electronic RI system is an excellent track and trace system, which is a boon to the doctors and to the patients. It ensures safe and secure handling of the gametes and the patients can feel relaxed. Additionally, the closed working chamber ensures optimum environment for the process of ICSI so that good quality embryos can be obtained. Similarly, the embryoscope, that is the time-lapse technology, is another helpful tool in monitoring the growth of the embryos. It is in fact a high-end camera which is placed in the incubators, which monitors the growth and evaluates whether it is optimum or there is any lag in the growth, so that better selection of the embryos can be made. Now, all these technological revolutions over the period of time has increased the spectrum of infertile patients who can be treated by ART techniques, whether these patients are over 40 years or of menopausal age or having tubal infertility or suffering from endometriosis, adenomyosis, unexplained infertility, or the male partner has some problem. So there is a treatment and management in all such cases. IVF has definitely transformed the life of many couples into a happy one. What was a painful and invasive approach through laparoscopy in the past is now a smooth, complication free, and affordable, pain free technique that has brought smile over 8 million couples worldwide. Today, we are all set, armed with the latest and promising techniques to fight against infertility. What is required is only awareness and willingness to move forward and avail these miraculous techniques. Remember, the best view comes after the hardest climb. So, how is the Josh, buddy? Let's give it a start, and victory will be ours. Thank you.